So our first speaker today is Dr. Marlene Miller. Dr. Miller is pediatrician-in-chief at University Hospitals and chair of the Department of Pediatrics at University Hospitals Rainbow Babies and Children's Hospital. She is an internationally renowned clinician and scientific thought leader in pediatric healthcare quality and value. Today, Dr. Miller is going to tell us about a new UH research initiative, Center for Health Services Research.
Well, good morning, everyone. It's really thrilling to come here. And after that nice introduction, I do want to say this area of research that we're looking to grow, even beyond where it is now at UH, is really diagnosis, disease, department agnostic. Health services research affects all of us. And for those of you that this is a new topic for, I'm hoping this brief presentation on where we are in developing this arm of our research will help you understand. So what is the scope of health services research? It's actually really broad, encompassing medical services and non-medical factors on how they affect the outcomes along the healthcare continuum. So what does that mean? It means not only assessing our actual outcomes in a real-life situation outside of a controlled clinical trial, but also disparities, looking at how the medical services, the delivery of the medical services themselves actually influence the outcome, looking at demonstration projects where we try to change the way that healthcare is delivered and see if that changes the outcome, regardless of the therapies involved, if you will. There's also the impact of non-medical events and factors, such as social determinants of health, that actually influence the outcomes that our patients have. Two patients can be getting the exact same therapy and have social determinants of health dramatically alter the outcomes of that patient, and health services research seeks to understand that. There's also a whole arm of different techniques that we need in terms of implementation science, qualitative research, informatics, economics. All of these factor into health services research, and this is the kind of area that we want to grow. A number of agencies fund this, both federal, non-federal, and actually increasingly so. For many of you that have seen some of the newest institutes that have been made in federal government, such as PCORI, the Patient-Centered Outcomes Research Institute, lots and lots of funding stream, and it's all in that health services arena. So the rationale of why do we want to build a University Hospital Center for Health Services Research is really pretty obvious. It perfectly aligns with our mission. We are that hometown team. We want to make differences in the outcomes of our patients and our friends in Northeast Ohio, and that is really health services research because it's pragmatic, it's real life, it's out there with all the factors that influence outcomes beyond our therapies themselves. We have a really, really strong foundation. As part of this project, I'll show you, we did an assessment of where we currently have health services research, and it's really amazing, including there's some new grants that we've just recently got, a $12 million grant from the CDC for vaccine effectiveness and social determinants of health, and then a $4 million grant from the Agency for Healthcare Research and Quality for diagnostic challenges, largely focused around primary care and also specialty care. There's also, as this implies, a significant source of funding for this. Dan and I were just talking about this, very different than basic science because of the complexity in real life, and often you have to link multiple health institutions together to do health services research. The scope of these grants are just mind-boggling at times, 25 million, 48 million for grants that really are looking at health services research. So as we launched this effort to try to further define and create a charter and a plan for growing health services research, we looked to the Agency for Healthcare Research and Quality's strategic framework that they were themselves revising. And you see it here adapted for us of how we think health services research can grow. There's all the way things from health equity and population and community health to both primary care and chronic care delivery, to the experiences of care, to making sure we align with national healthcare priorities around what should be the standard of quality and how do we actually improve our system scientifically to achieve that quality and go beyond, methodologic excellence, and also very important training and education. For almost every single physician in this group, your board is going to require you have demonstrations of quality improvement skills. It's a growing area, and that is what health services research is. It's how do you actually change the providers and how they deliver the care, and that's quality improvement, and it's a growing area. So our goal is that all trainees, from medical students to residents to fellows, that we're going to have opportunities for them to be exposed to health services research skills and methodology, both for their personal use in their career and if they want to grow in a career of their own in the health services research over time. And you'll see the areas over more to the left-hand side are really sort of evaluations of policy initiatives, and the more you go over to the other side, it's going to be investigator initiated, and there's a blend that's all in there because you can't think about health services research without taking that continuum from actual bedside to the patient all the way to policies that we involve in our institutions and our government structures, et cetera, that have influences on health outcomes. So earlier in 2022, we started a project roadmap for development of this. And we started with both assessing the current state that included surveys and stakeholder interviews, profiles of what we're doing in terms of our own research. And then we established a vision using some of the visions that are also influenced, like the one I just gave you, the strategic framework from the Agency for Healthcare Research and Quality. We looked at our current grant infrastructure, our models of how we're currently organized, then started creating a plan for growth, a plan for logical structure, and a plan for investment and a roadmap of where we want to go as we develop the University Hospital Center for Health Services Research. We partnered with a consulting team, Manat, and you see the team there on the left. And we also had an advisory committee with a lot of representation across all of University Hospitals and Case Western of folks that are in this space and health services research to guide us as we went about our process. We did a lot of stakeholder interviews, including with Case Western Reserve, with the dean, and with Cliff Majarian and other leaders across the university hospitals, again, to take in the information of where are we currently and where do we think we can grow and make this fit in to a university hospital's research portfolio. The center, the vision for it, and its key features. We seek to develop a center that's based at UH and at Case Western Reserve School of Medicine, and in collaboration with other strategic partners that will catalyze excellence and national leadership in the science of creating, translating, evaluating, and broadly disseminating foundational evidence and policy recommendations, all focused on improving the outcomes of our patients. We want to have a national leader. We want to incorporate faculty both in the clinical and the basic sciences. We seek to have a portfolio of core services to support health services research and then coordinate that across all of the departments and areas across UH and Case Western Reserve School of Medicine. It's going to incur incrementally. We obviously have a lot of foundation already in place, but we need to kind of grow strategically as we build out this center, much like we did with our own Center for Clinical Research here. And then we seek to have further partners over time. And again, in the last bullet there, you see one of the key pieces in there is also thinking about our trainees, both in terms of real trainees, in terms of residents and fellows and medical students, but also junior faculty. How can we support them in getting the needed skills to launch their careers in health services research? The objectives, and really four, and they sort of go in incremental boxes, if you will, of how we're going to seek to strategically, incrementally grow this. First, we need to grow our funded investigators, organize them a little better. We have many silos, but we're seeking to organize and then grow that, and then catalyze it through a little more supportive research infrastructure that is needed for health services research. Build our capacity, as I mentioned, in education and training. And then obviously what flows next is once we've built that core structure, now we are perfectly poised to really launch out there and do amazing projects on community impact of our health services research infrastructure. So our future state, you'll see a Center for Health Services Research with a director and leadership roles up at the top. We imagine there'll be some faculty there within the center, but many faculty be appointed and actually be in their home departments and then have broad reach across all of university hospitals and Case Western. There'll be some key cores, mixed methods, data management, community engaged research. You know, these are core skills and talents that we need for health services research. I've already mentioned the education. We're envisioning certificate programs, full master's degree programs, and even trying to build in tuition remission so that faculty and junior fellows, are encouraged and have a path forward to apply for formal training if they seek. Obviously, we'll have community and outreach partnerships and then an administrative infrastructure over this on top. The Center Director Phenotype. We are soon going to launch this search. Our goal is to have a physician scientist with multiple disciplines of health services research, ideally multiple grants already in their portfolio, and some organizational capabilities from their own institutions. Many centers, many institutions have already stepped foot into this of formally organizing health services research, and we are hoping with the incredible infrastructure that we have here and a whole plan for growth that we can recruit and retain a really successful leader to then set the pace and take this off running. I will stop there and take any questions or comments.
Questions?
Everyone hasn't had their coffee yet. Come on.
Because I'll start it off.
Sure.
There has been talk that CASE is going to move toward a school of public health. How do you see that integrate with the health science research?
I see that.
Can you repeat the question?
Oh, sure, sorry. The question is that there's been some consideration that CASE would like to develop a school of public health, and how does that integrate here? I see it completely hand in glove. We could, in theory, have a school of public health, and this is a whole arm of it. When you think about health services research, you need patients, and that's what we have at UH. The patients are university hospitals, and we have the ability to influence their outcomes. But there's a lot of things, if you remember, that are also policy-oriented, and that's where schools of public health come in also. And I think this would be just a natural extension of it, of then partnering with CASE when you think about looking at policies from the county or the state or the federal government, and how does that influence the outcomes of our patients that are university hospital patients. So I think it would be thrilling. It would enable us to even further build out the core capabilities. For those of you that know a school of public health, they often have a whole department of biostatistics, a whole department of epidemiology, a whole other departments that I think would just serve us well, and our core functions would just be perfect additions to that with synergy. Ted.
Marlene, can you outline, as you did this analysis, what are our strengths? You said we have a lot of strengths. Wait for microphone. I'm sorry? No.
Oh.
Yeah, so first of all, thanks for a great presentation. I think as you did your analysis with Manat, if you could sort of give us an understanding of what our core strengths are and then what are our gaps, so that we can get to this roadmap moving forward.
One quick question. E, do you know if my appendix slides are loaded up here? Okay. You know what, Ted? I will send them out as part of it. We did several surveys, and there's some great slides that summarize areas where our leaders, our department chairs, institute directors find that they have strengths and where they have weaknesses. And it's a whole continuum about 12 different areas. And it's not surprising. One of the weakest areas that everyone felt is, how do I train my own faculty in health services research, where no one felt they had those capabilities, right? So I will send those out to everyone through there because they were built into the appendix slides, and it will answer a lot of questions. And it really highlights the amount of success that we've had, which is truly inspiring without an organized structure around it.
Great.
This is really terrific. You touched on my question. What advice would you have for faculty, especially junior faculty, who have interest in this area but don't have any formal training?
I would obtain training.
But
Hands
I guess
down.
what resources here? Who would you direct them to here locally as we seek to build this here?
So there's many programs, and again, one of the many benefits of COVID is that a lot of things are now Zoom. So many schools of public health, and we're seeking to grow this in partnership with CASE, have a 4-week certificate program, a longer program maybe for the whole summer, 1-year master's programs, right? And part of our goal is going to try to see if we can work in partnership to build in opportunities for tuition support for that. But there's a whole menu, and the question then is what will fill the needs for that person, all the way up to full PhDs in health services research. They all exist, and it's all a matter of what speaks to someone's personal goals. Yeah.
Sorry. Frank, I wanted to address this because I think it's really important. Marlene and I have been working with Steve Wilson as well as with Sarah Ronis and others. We're going to make a commitment from UH-R&E to revise a summer sort of Harvard School Public Health Clinical Effectiveness-like program, a 4 to 6 week curriculum ideally for fellows in their research year or junior faculty that are 1 to 2 years out, that will be given the time to go, and we will provide tuition coverage for that from the central UHR&E group. I think it's really critical that you light the fire when you have an area of clinical interest that sparked you, preferably in fellowship, so then you can see the opportunities that you have either for K funding or even to move on to master's level funding. So that will come from UHR&E this summer. Ted, I just wanted to address one thing, just to give you a sense of the success that's very diffuse. Jory Mintz, our VP of IR&D, related to this area of funding from foundations and government, her team from 2019 through 2026 has $82 million now in funding from CDC, AHRQ, and HRSA. So there's a very strong diffuse effort across departments and investigators. What hasn't happened is a coordinated effort, which we think could really catalyze even further growth.
Is this center going to be funded out of those existing funds that we've been successful in securing, or is it going to require additional hospital resources? And if so, what are the most important, crucial aspects of the center that do require resources outside of our funds that we've won so far?
So I think it's going to be many sources of funding, right? You know, even our current grants, there's a lot of indirect dollars that we can use to grow the center. This is going to be a wonderful target for philanthropic donorship because it translates easily. Donors understand this. This is health services research about their outcomes. We also have opportunities with our chairs, with support packages that they have to grow and fund this. So there's going to be many arms that are coming into this. When I look at it, I think one of the core areas is that methodologic expertise and the training. You know, we have investigators that are successful, but they're sort of like bright, shiny stars all alone as opposed to one big lit up panorama, right? But the methodologic skills that are unique, we need to have those here. Again, biostatistics, epidemiology, qualitative science, right? Survey design, those kind of things we need to do. And also then training all of our trainees and junior faculty, because this is a skill that will help us operationally and help their own careers. Thank you.